Thank you, Madam Chair. Mr. Chester, I wanted to ask a question about Pyro. Because even as fentanyl devastates our communities, more is coming in. In Colorado, we're just starting to see Pyro, a drug that appears to be 10 times stronger than fentanyl. And I know, Mr. Chester, you've made disrupting the supply of illicit drugs a major focus of your career. And how do illicit drugs like Pyro, where do they come from? How does it end up in Colorado? And what is the administration doing to try to intercept supply routes?
Yes, thank you for the question, Senator. And I know in particular I-75 is a major corridor for you in the amount of concerns that are involved with the physical movement of drug throughout your state and really throughout the region on that corridor. That particular drug and others like it, and I want to be clear kind of in our characterization here. So you have fentanyl itself, and then you have fentanyl analogs, which are alterations, additions, or substitutions to the base fentanyl molecule, an entire class of substances. And then you have other non-fentanyl synthetic opioids, and that's the nitazene family, and those are others that come up. The reason we see them is for two reasons. Number one of the best accelerants for the production of a new drug is action taken against an existing one. These are profit-seeking enterprises that have very smart chemists who want to market new substances, post them on the internet or on social media for availability, and get people to be early adopters to them. So that's the first that's the first way that you see them. And the second way that you see them is it's generally product placement. They have the available precursor chemicals, they have a chemical formulation they can get on, and they advertise it as having a certain qualitative effect on the body. All of them are illicit. All of them are dangerous, and all of them are available on the internet and on the dark web and to be shipped in either physically into the United States or across our borders through mail and express consignment. The last thing I'll tell you is and I know the Rocky Mountain HIDA very well. We're very proud of the high intensity drug trafficking areas program that we administer and manage here in ONDCP. It's organized. We've extended the overdose response strategy for the HIDA program to all 50 states, the Virgin Islands, Puerto Rico, and D.C. That brings together drug intelligence officers and public health individuals in order to be able to better understand the environment, identify those new and emerging threats like the one that you just mentioned, to be able to take action on them. And they do very good work.
And thank you for the support of HIDA. They're very effective. Remarkably effective. Dr. Delphine Ridman, fentanyl's killed 1,600 Coloradans in the last almost 3 years. Just a few months ago, we had a high school sophomore from Durango, Colorado, who died from an accidental fentanyl overdose. We received $23 million, maybe a little more than $23 million for the Substance Abuse Prevention and Treatment block grants as part of the rescue plan, the American Rescue Plan. As this help goes out across Colorado, do you see, or what specifically do you see as the most effective utilizations of that funding? What are the best investments we can use to try and go after the fentanyl overdose rates? And how is SAMHSA working with states to provide that real-time information and data and technical assistance to get there?
Yeah. So often what we find is states will use the strategic prevention framework approach to being able to identify approaches and strategies that will work most effectively within their context. So many of the community coalitions will do focus groups, meet with schools, meet with students to be able to develop messaging that's going to resonate with students and resonate with schools. And in some instances, the coalitions will work with schools and students to develop some of that messaging so that it's really coming from students. So I think that's one thing that's helpful, developing messaging that students can take in and that raises awareness about the dangers of fentanyl, to include social media access of fentanyl, as well as just the dangers of fentanyl use. I think another strategy that can help is working with schools to raise awareness about and being able to identify students that may be struggling with substances or that may be having trouble, and ultimately being able to connect those students to services and supports.
Right, thank you. And I think we're making progress in actually identifying the types of kids that would be likely to experiment. So often, with fentanyl, it seems like so often it's somebody who has almost no experience in drug use. Not always, obviously, but too often. Anyway.